Okay, we're going to start with introductions. I'm Wendee, and I'm on staff with Dr. Saxon. And
I'm Deb, and I'm a patient of Dr. Saxon, and I've been seeing her for probably about 10 years.
okay, so Deb and I have both gone under the knife with Dr. Saxon for a facelift, deep plane facelift, and we're going to talk a little bit about our experiences. So, first of all, I'm going to have a caveat. Deb did not do her facelift until after I did it. She said I was her guinea pig, and I thought that was like not even fair because she's known Dr. Saxon much longer than I've known Dr. Saxon.
I was like, oh wow, she looks amazing.
So Deb looks incredible. And Deb, how many months out are you?
I had it beginning of June, so 4 months.
Oh wow! And I had mine in February, so I'm just a few months ahead. The funny thing is, Deb is experiencing something that is very normal right now in the journey and facelift world. Deb, explain to them what that.
So I had a brow lift as well as a deep plane facelift, neck lift. With the brow lift, your experience after surgery, your top of your head is numb. It's numb for a while, but the feeling comes back, and it's coming back. And I was just telling Wendee, I'm like, oh my gosh, I can't stop itching my head because it feels so good because you can actually feel it now.
Yes.
But it does come back.
It almost feels like something's crawling a little bit on you, so you think you have to itch or scratch.
Yeah. It's
but
so
then
weird.
when you scratch, it feels so good. You get the best scalp
Yes.
when you're cleaning your hair. It's like, oh, this feels so good.
Yes.
So, and I was like, yes, that's very normal. I even told Dr. Saxon when mine stopped doing that, I was like, I kind of miss it. Feeling that good washing your hair. But a few of the things over the course of the time since I've had my facelift, we have patients coming in more frequently and more frequently for facelifts with Dr. Saxon, and patients want to know kind of the experience. So Deb and I are going to talk a little bit about that. And I am fortunate enough to have been a couple months ahead of Deb, so I did tell her things like, be sure to purchase the wedge pillows. I'm very much a side sleeper. It did not break me from being a side sleeper. But during the time of healing, it did help me to stay on my back because you want to stay elevated on your back to reduce healing, to reduce the swelling and stuff. And Deb, are you still on your wedge?
No, I'm a side sleeper, so I eventually merged back into side sleeping again.
Yes.
But I did have the wedge, and then I also had a recliner that was very comfortable to relax in and recover, but the recovery was way easier than I was expecting.
That was my experience as well. And I tell people all the time, I almost feel like I'm almost afraid to say it was as easy as it was,
Right.
because you're like, is that easiness the normalness of it?
Right.
Do you agree with
Yes,
that?
yes, yes.
And Deb and I have both had morpheus-8 treatments prior to our facelifts, and I want to see if Deb agrees. Was your facelift easier than your morpheus?
Yes, for 100%. It was that the lasers or the Morpheus with those type of treatments are, in my opinion, harder to recover from, or just more dramatic in the recovery. With the facelift was, I was back to work at 2 weeks.
Okay.
Prior facelift.
And I was back to work at 6 days only because I work in the industry, not because I looked any better. It's just that people want to see what you look like at 6 days in our industry. If I worked anywhere else, it would have been for sure 2 weeks.
Yes.
And we tell patients that all the time, and they look at us like we're nuts, because many times after a laser treatment, you still don't look good enough to go anywhere after 2 days.
Right.
And you almost don't feel good enough to go
Right, you
anywhere
don't.
after
Yes,
2 weeks.
yes.
Lip lifts. We both also got the lip lift, and I want to ask Deb her honest opinion. How do you like your lip lift?
That was my most favorite thing about it. I got just out of surgery. My daughter was my caretaker, and she had picked me up from the surgery center, and she said, "Mom, you got your lips done." And I said, "No, sweetheart, I didn't get my lips done." And she's like, "It looks like you got your lips plumped." And it was just the lip. That's how dramatic it was. Yeah.
I say the exact same thing, that the lip lift, of all that she corrected on me, I love the effect of the lip lift. I think it is the most anti-aging
Yes.
Or maybe it's just that that's what we notice the most. And that funny thing is, my husband has said nothing except,
Oh, yeah.
I see your teeth more. That's it. You know. So, and then the last thing, let's talk a little bit about the aftercare as far as, we use a gua sha stone. I use it on everything, but Deb mentioned some things in visiting with her that I don't think we realized, because as you know, we have sutures that go along the tragus, around our ears, and then back down our hairline, and that seems to be the part that lingers the longest, is the best word I know to describe it, and that we feel it. Not that anybody sees it, because of course it's in our hairline, but we feel it the most. And so, Deb, what have you been doing for yours?
So I notice it when I wake up in the morning that it's kind of a little bit swollen behind my ears, but that's the only thing that I still feel swollen. I used to feel like it was swollen in my neck, but now that's subsiding. But I've just been doing like a massage with my hands, but Wendee reminded me that I should be doing gua sha
use the gua sha stone. You know, and I want to really stress that gua sha stone is not about pressure, it's just about movement, because you can do damage going too hard with the gua sha stone, so just really press it. I do up and down, and then I do back and forth, and you can kind of feel the rim, you can kind of feel the bump.
Right.
But it does. But it's funny because I think we both experience the same thing. I told Dr. Saxon our ears get in our way because one side feels a little bit different than the other side, and I think it's both of us, all of us on our right side, we all feel the same thing.
Yes.
And I think it's because Dr. Saxon's right-handed, and she's sitting above us, and she's suturing, and I think that our ear makes her hold the needle just a little bit differently.
Yeah.
And that's just Wendee's hypothesis. Because I work with Dr. Saxon, I'm always trying to figure out things. Yeah, what is it? And so, just like we all had the same suture in our nose, in our lip lift, that we all kind of was concerned about because we didn't know to not be concerned. And we're like, nope, that's normal. And one side or the other, and it's either the tie off, the start, or it's the tie off at the end.
Yeah, and then it heals.
And it goes away. But we both played with ours, like, what's wrong with this? So,
and the nice thing is that they give you a box of goodies. So the gua sha stone is in the box. You don't have to worry about anything. They give you a box of everything you possibly need for post-surgery care. So that I just had the box there and just picked out all the different goodies that I had for post-surgery care. It was wonderful.
And when you came to Austin, because Deb is a Dallas patient, and you came to Austin, of course, for the surgery, did you stay in Austin downtown, or did you stay near the
I stayed right by the surgery center.
Okay, perfect.
Yeah.
Okay. And the office, just so that you know, the office is about 20-25 minutes from downtown. So patients can pick if they want to be closer to where they're going to go bright and early in the morning for a surgery, or if they want to be where they're going to get up the next day and come to the office for their first.
And it was a very simple drive, and
it's simple.
Didn't have any problems.
And for our patients that are in state and within just a few hours, Dallas and Austin, for those that don't know, is about three hours and 15 minutes apart. So most of our Dallas patients come down, they spend the night before, and then they can come back the same day. We do ask that they stay the same day as their post-op. You have to stay overnight, because with a facelift, you have a next day post-op.
Right.
And if you're a Dallas patient, we try to make it to where the only appointment you have in Austin is your very first day post-op, and we do everything else in Dallas.
I went home. I did my post-op appointment, and then went home that same day.
Yeah. So, do you have anything else you would like to add?
No, just that I wish I would have done it sooner. So
I wish Deb had been the guinea pig.
Yeah.
But it really doesn't matter. We both got the same
My
result.
one regret is I didn't do it a lot sooner,
Yeah.
but it's done. So I'm very happy with it.
Thank you.